Get ready, Central Georgia.
This is Alex Habersham, publisher of the Macon, Middle Georgia Black Pages. I'm happy to inform the community, particularly business owners, that we're working on a new edition of the Macon, Middle Georgia Black Pages and Resource Guide.
Coming soon.
So call today. You need to be a part of this.
Your resource guide to identify Black-owned businesses throughout Central Georgia.
We either get your free listing and or your ad in the upcoming edition.
We try to make it very easy through our book, electronic and digital formats, and social media. Reserve your ad space today.
Call 478-464-0074.
Visit our website at maconblackpages.com.
You cannot afford not to advertise.
Download the app.
The new Macon, Middle Georgia Black Pages and Resource Guide is on the way.
Coming soon.
Too often people don't realize the importance of medical care and the importance of providers as it relates to medicine and medical care. And even more important is that a lot of them, medical technicians and medical professionals, get a lot of recognition, and the public really kind of understand what they do. But I tell you, a technician or a professional that plays a major role in medical care, and that's nursing, and I've been in their presence enough to know how important, nurses are. And we're very, very fortunate today to have a young man. I did say a young man because back during the day, Donald, all of the nurses were females. So it's kind of interesting to have a male in the person of Donald Smith, who is a nurse and who holds a very, very high position with Atrium Health. So we're going to talk about nursing today, the role of nursing, the importance of nursing, the function of nursing, and how they play into nursing and the pandemic. So I'm just so happy to have with me Donald Smith. Now, what goes after your name, Donald?
RN, MSN, CCRN, Assistant Vice President of Nursing Services here at Atrium Health Navicent.
Okay, well, since you're talking about all those initiatives and initiatives, tell us a little bit about yourself.
Well, I'm from a small town outside of Albany, Georgia, in South Georgia called Sasser, Georgia. You probably never heard of it. It has a population of about 550, 549 because I'm not there. But it's a small farming community, part of Terrell County, there in South Georgia. Graduated from Terrell High School back in 1991, and went to Valdosta State University and received my nursing degree in 1996, Mr. Habersham.
Okay, now, what did you start out at? What position? Where did you start in what position?
Here at Navicent. So yeah. I started Navicent back in 2002. And I started as a bedside nurse in neuro ICU, working under Gwendolyn Smith. She mentored me, which I contributed a lot of my success to. She was like a mother figure, to be honest with you. She told me the things I needed to do to fulfill my dreams and goals that I had set for myself. And I just followed the outline or blueprint that she gave me.
Outstanding. Now, let's talk about there's several functions and roles that nurses do.
So nursing, they wear a big hat, especially if you talk about what nursing truly is. It's a person that provides high quality care, that is not biased, that serves any person of any socioeconomic status, regardless of who you are, with the same level of care. They must be compassionate, caring. They must be understanding, patient, uh, someone that can listen. The touch is one of the things that nursing uses to help healing. And I think in this day and age, it has gone away a lot because of the pandemic and things that are out there, different viruses and those type things. But touch is huge in the realm of nursing. Just a comforting touch sometimes can relieve a patient's anxiety and the stress that they may be under.
And there's a time factor too, because the doctors are busy, but so it seems that a nurse will kind of spend more time, with the patient and somehow try to develop a relationship. I had a hands-on experience with that situation this week with my father-in-law, who will be 96, on
Wow.
April the 11th, who was in the hospital and had a blockage, an esophagus blockage. And of course, considering his age and, his outlook on certain things, then he didn't want to get it cleared out, and he was really adamant about that. But because of that touch, you know, from the nurse and the nurses in that situation and the doctor, then they were able to convince him to do it. So I guess what I'm trying to say is that although there is a medicinal role, as it relates to nursing, but there is also a psychological role, as it relates to the interaction between the nurse and the patient.
Yes, yes, it is. Because that comforting touch can sometimes get a patient to change their viewpoint on something. We run into situations all the time where, folks of elderly age, they're set in their ways and they're only going to do what they want to do. Once the physician comes in and speak with them and give them the plan of care, sometimes they don't understand it. So the nurses, we break it down in layman's terms for them, to them and their family member, and let them know, hey, these are the potential side effects, outcomes, and this is what you should expect. Typically, if you are a routine case, outside of something abnormally happening, the nurse, it's kind of cookie cutter. But what we do is we're there, we support them, we listen to them, we explain it to the family 2, 3, 4 to 5 times, however many times it takes, because sometimes family members or patients don't understand, completely, and until their light bulb goes off and they fully understand it. That's what we're there for, to try to break it down for them to understand it.
Talk a little bit about give us your title and your position at Atrium and, what that entails.
So currently, I took this position in 2016 after being a director of um, 3 of the ICUs here at the hospital. I was promoted to Assistant Vice President of Patient Care Services. Currently, I'm over 4 ICUs and five med surge floors, which provide care for patients coming out of the ICUs. Um, as far as intensive care, those are the sicker of the sick patients. Those are in the intensive care unit. Those are the patients that are on life support, that requires a specialized set of care from our nursing staff, which goes through our ECHO program and gain those skills coming straight out of school. So I have probably about 150 employees that report not directly to me, but under me, that I manage and lead.
Outstanding, and congratulations. Well, talk about what is it, magenta? What is it? Magnet nursing. Magnet nursing.
Magnet, wow. I'm glad you brought that up. So last year, Atrium Health Navicent, we received our 4th designation as a magnet nurse. Being a magnet facility, for nursing, that's the highest recognition you can possibly receive as an organization for your nursing department, and that entails being empowering our nurses to make decisions here within the organization, to change the practice, which we all look at, evidence-based practice when we're delivering our care to our patients. We want the latest and the greatest that science has come up with to have better outcomes for our patients. So that's what we do here. Our nurses have a huge voice in the things and the decisions that we make. Our decisions are not solely made by our chief nursing executive, Tracy Blaylock. She governs and sees what we do and looks at what we do, but she brings it to the nursing staff, the bedside nurses, to have so they can have some input. Speaking of Magnet, we are one of 32 hospitals that have received the fourth designation. Being a Magnet organization, you get audited or surveyed every 4 years. It's not something that you continuously have. You have to get audited and surveyed. So we had surveyors come in here in last year, September, October. It was a week-long survey. It was virtual. We were rolling around with iPads on stands. They were at home in the comfort of their homes, looking at everything, looking at documentation. They actually spoke with over 700 nurses to find out if what we had wrote in our document was actually true. So if you've interviewed 700 nurses, they're trying to see if there are any deviation in anything that we put in our document, and they couldn't find anything that said otherwise. So they gave us high regards and high grades in receiving our fourth designation, which, to me, I tell my colleagues all the time, I think being a Magnet facility here in Central Georgia, we're the best kept secret, because some of the bigger hospitals in the area, they hadn't received that designation yet. And we're just very fortunate and pleased that we were able to provide that to our community here.
Okay, talk a little bit about two other things for me. First
Yes,
of
sir.
all, donuts with Donald. What does that?
Oh,
What is that about?
Oh, it was a brainchild of mine that I felt like I developed to go out to staff, and I spent a lot of money at Krispy Kreme bringing in donuts to staff to celebrate with them, and to just meet with them and talk to them and get them to share some of their thoughts, some of their ideas, and for them to bounce questions off me. And I did that for an entire year, and it was something that I gained a lot of trust, and a lot of folks really appreciated that. Staff, sometimes they say you get so busy and you can't get down to your frontline staff. I took time out and made sure that I was able to connect with my frontline staff to see what they needed and what I needed to do for them. They were very appreciative.
Outstanding. Well, I mean, I know that you don't want to pat yourself on the back too much, but talk a little bit about that very, very prestigious award that you received.
Well, back in 2008, I received a award for excellence in nursing leadership from an organization called Georgia Organization of Nurse Leaders, and that's the nurse leaders that are all over the state of Georgia. I was recognized by my chief nursing executive here, Tracy Blaylock. She wrote up an outstanding story on me and the things that I have done within the Navicent Health walls here. And she submitted it to GONL. And out of all of my peers that are part of GONL throughout the state, they selected my story for the body of work that I have done over the years of being a nurse here at Atrium Health Navicent.
That's very outstanding. Well, I know that we're going to have some young people uh, viewing this interview and listening. Talk about nursing as a profession and what kind of, what are the employment possibilities? What's the kind of gratification that one would receive from, choosing the field that you chose? Obviously, you seem to enjoy it tremendously, but talk about it as a profession and whether you would encourage young people who want to get into fruitful vocation to involve themselves in it.
I would stand in my chair and yell it as loud as I possibly can to anyone that would possibly listen. It has been the best profession, the best career field that I can possibly have decided to go into. It's always changing. I've gotten to the point where I know that my day is not going to go as planned. It's something always new happening here, and you have to have to embrace it and take it as it comes. But the career of nursing has so many different avenues. When I started, college back in '91, uh, I didn't know. My mom just said, "Hey, you need to go and find a career field that you can get a job as soon as you get out of school and take care of yourself." So I said, okay, I went down there, I talked to my counselors. They say nursing is a great field. But like you mentioned, it wasn't a popular field for males to be nurses back in the early 90s. It was kind of, folks looked at me kind of sideways when I said I was going into nursing. And I embraced that and fought right through it. During the time that I was down at Valdosta State, I pledged to a fraternity, Kappa Alpha Psi, and my frat brothers were looking at me like, "You sure you going to nursing? You don't want to go into business?" But I was kind of a visionary. I had researched it and saw what it entailed, and I wanted to be a part of that. Growing up in Dawson, Georgia, I worked at a neighborhood service center, and I was able to work with some elderly clients there, working with Meals on Wheels and seeing, how appreciative they were for me to come into their home and provide meals and to do different things for them. I was like, man, I think I like this thing of service and being able to, touch and make people happy and make them feel better was one of the things that I really looked at. But, students that are out there that are choosing to or thinking about going into nursing, it's the best possible field. It's so many different avenues that you can go in here. Like for myself, I'm into leadership right now. You can go and become a nurse practitioner. You can go and become a certified registered nurse anesthetist. That's what my wife is. I married a nurse. So nursing, I encouraged her to go back into nursing when when I initially met my wife back in 2004. She said, "Oh, you're a nurse," and she didn't believe it. She a male nurse. I was like, "Yeah." So when I first met her, I hate to get off script, Mr. Habersan, but
Go ahead.
when I first met my wife, I told her I worked here at Navicent, and she said she thought I was a janitor. And I was like, "Why?" I said, "Why?" She was like, "I just thought, you were a janitor." Then I told her I was a nurse. She was like, "You an LPN?" I was like, "No." She couldn't. I said, "I'm a registered nurse." She couldn't believe it because
Wow.
of I guess the picture that people have painted over the years, you know, for somebody that works at the hospital and they're African American, they must be at a lower level, entry level as a janitor or housekeeper. Nothing wrong with janitors or housekeepers, but that was her thought process. And with me telling her that, it just enlightened her, and I opened her eyes to a whole different career field.
Wow. Wow.
And I like I say, I'm very thankful and blessed to be where I am today. It's been a lot of people that have supported me and pushed and directed me in the right direction. I would have to say that for you, I use you as a mentor on the times that we've had conversations. You've always had positive things to say, and I look up to you and your show as well.
Thank you. Thank you very much. excuse me, now has do you have more males in nursing now? I got two questions. One, when you said 700 nurses, does Atrium have that many nurses, or did they interview people from other facilities?
So does medical center, we have roughly between 2,500 to 3,000 nurses that work here at Atrium Health Navicent.
Wow.
So for the magnet surveyors they had sessions for over those 5 days where they were having 25 to 30 nurses, interviewing and talking to them at a time. So over those 4 to 5 days, they were able to communicate with that many nurses. So it's quite a few. And as far as males, to your second question, the career field is flooded with males now. I'm not rare anymore. I'm not a rare breed anymore. I walk down the hall, I see as many male nurses as I do female. Females kind of still outrank us a little bit, but not by much. But it's kind of amazing how the career field has evolved.
That's good enough. Now, if a person is in, say, a junior in high school or getting ready to graduate and getting ready to go to college, the job market and the job demands are just changing every day. And then, as a matter of fact, COVID kind of modified the whole job perspective in the country. So is it projected that there will still be good opportunities for a person who goes into nursing?
The opportunities are bountiless. I mean, when I say that, I mean, since 2008, when we had the economic turnaround, potential recession time period back then, a lot of folks got laid off, and all of those things. I've never had to worry about getting laid off or anything of that nature, simply because people are living longer. They're always going to need someone to take care of them. The career field, we're at a shortage. They said 2020 we were going to be at a shortage. We're still at that shortage. The next 5 years, we're still going to be in a shortage, because as nurses get older, they retire, or they decide to go into another career field that branches off nursing. So it's always going to be an opportunity to become a nurse, to work somewhere in healthcare. So I think, if a junior or senior decided to go into nursing, it'll be the best opportunity or the best decision that they can make, because they could do so many different things. Just to give you a quick story, back when Brown and Williamson closed here in Central Georgia, we had some folks that went back to school from Brown and Williamson and came into nursing. And they used nursing as a launching pad to do something totally different, which was huge. They were like, I'm going to do nursing. They were working on nursing while they were there. So when I guess they had got inkling that the plant was closing, so they had started working on it. They came here and worked right after Brown and Williamson left Central Georgia, and made nursing their career, and they just took off. So nursing has, or healthcare in general, has a huge place in the economy and the job market across the nation.
That is so outstanding. Well, let me just take a couple of moments to congratulate you, Donald. You may not be fully aware of the role that you are playing, not only at Atrium, but in our community, because there's so much need, for African American men, to be reflected and shown as being successful. And so you talk about me as a role model, I'm calling you one, and I appreciate everything that you're doing. We're going to take a quick break, and we'll be right back.
Get ready, Central Georgia.
This is Alex Habersham, publisher of the Macon, Middle Georgia Black Pages. I'm happy to inform the community, particularly business owners, that we're working on a new edition of the Macon, Middle Georgia Black Pages and Resource Guide.
Coming soon.
So call today. You need to be a part of this.
Your resource guide to identify Black-owned businesses throughout Central Georgia.
You either get your free listing and or your ad in the upcoming edition.
We try to make it very easy through our book, electronic and digital formats, and social media. Reserve your ad space today.
Call 478-464-0074.
Visit our website at makingBlackPages.com.
You cannot afford not to advertise.
Download the app.
The new Making Middle Georgia Black Pages and Resource Guide is on the way.
Coming soon.
And I took a break. As I was taking a break, I was commending Donald Smith, RN, and other initials behind his name on being a successful young man, a successful professional, and a successful African-American male who serves kind of as an image to show that you can be successful. So I appreciate you, man. Keep up the good work. Congratulations to you and your wife. Tell your wife that I'm glad she listened to you. And we appreciate you all for serving the medical community. And, you know, it's very appropriate that you, your wife, and everybody else in nursing is recognized because of the significant role that you all play in the community. So May is Nurses Appreciation Month. So I want everybody out there to think of a nurse you know, and we're going to give nurses shout outs on my Facebook page, Making Middle Georgia Black Pages and Resource Guide. Just go to it and join it, and then give your nurse, nurse, like I said earlier, nurses play an important role. And I had a personal experience just this week. So show nurses your appreciation. Show Donald and Mrs. Smith and all the other nurses who play such an important role, your appreciation. This is a call to action. I'm your host, Alex Habersham. Have an interview. Mr. Donald Smith, RN. Keep up the good work, young man. Y'all have a great day.
Get ready, Central Georgia.
This is Alex Habersham, publisher of the Making Middle Georgia Black Pages. I'm happy to inform the community, particularly business owners, that we're working on a new edition of the Making Middle Georgia Black Pages and Resource Guide.
Coming soon.
So call today. You need to be a part of this.
Your resource guide to identify Black-owned businesses throughout Central Georgia.
You either get your free listing and or your ad in the upcoming edition.
We try to make it very easy through our book, electronic and digital formats, and social media. Reserve your ad space today.
Call 478-464-0074.
Visit our website at makingBlackPages.com.
You cannot afford not to advertise.
Download the app.
The new Making Middle Georgia Black Pages and Resource Guide is on the way.
Coming soon.